story reflects the strength, determination, and compassion of the people it serves. The origins of this facility are as humble as they are remarkable. The first healthcare facility in our community operated from a small building on what is now the southwest corner of our campus, a structure that in an early chapter of Yerington's history had served as a brothel. From that unlikely beginning, a vision of accessible, quality healthcare in Lyon County began to take shape. In 1954, construction of the new hospital began with the help of Hilberton funds, a federal program created to bring modern healthcare to underserved communities. The facility was officially opened and dedicated in March of 1955, marking a new era of medical care for Lyon County. The need for such a hospital was clear just 2 years earlier in 1953. The Anaconda Copper Company had discovered a large copper deposit near Yerington and announced plans to bring more than 1,000 employees and their families. In response to this population growth, the newly built Lyon Health Center, later known as South Lyon Medical Center, was established as a county-wide hospital offering surgical and obstetric services, including labor and delivery. And many of our community members can probably say they were born here. Actually, when we delivered, not by us. As the community needs evolved, so did the hospital's mission. In 1963, the facility recognized the growing need to care for individuals no longer able to care for themselves. The Dr. Mary Wing was constructed to meet that need, initially providing 19 skilled nursing beds. As the demand for long-term care increased, an expansion in 1998 added 30 additional beds, allowing the facility to now care up to 49 residents with compassionate and supportive care. In the late 1970s, as physicians in private practice began leaving the area, the hospital once again adapted to serve the community by constructing a 2-provider clinic, ensuring continued access to primary care. That clinic, named after longtime administrator Clara Barnett, remains in operation today, serving patients 6 days a week. In 1998, with growing demand and a need for additional space for primary care providers, the facility expanded once again, adding a 4-provider clinic on the Yerington campus and a 2-provider clinic in Smith Valley. The Smith Valley Clinic was made possible through the generosity of the Weaver family, who donated the land to which the facility was placed. When Anaconda Copper Company ceased operations in the late 1970s and early 1980s, the region experienced economic decline and population loss. Despite these challenges, South Lyon Medical Center has remained steadfast in its mission to provide quality, compassionate health care to the people of Lyon County. From its modest beginnings in a converted building to its growth into a comprehensive healthcare center, South Lyon Medical Center stands today as a testament to the resilience, innovation, and the enduring spirit of our community. With that,